All or most people with or without disabilities are sexual beings. Disabilities can take on many forms: intellectual, emotional, behavioral, physical, and that can have varying impacts on sexuality, including no impact at all. Individuals with disabilities have sexual thoughts, feelings, and concerns just like anyone else, and learning about sex and sexuality is an important part of development. Autistic and other people with disabilities go through puberty, desire relationships, both friendships and romantic relationships, and experience sexual feelings. Disabled people, like all people, have inherent sexual rights. These rights and needs must be acknowledged, defended, and respected. People experiencing disabilities have the same right to sexual education as their peers. Learning about sex and sexuality allows people to make informed and safe decisions. However, modifications to programming may be needed so the person that you are supporting is able to learn the material in a meaningful way. Understanding our sexuality is a lifelong process for us all. Sexuality is not just about intercourse or other physical expressions. It also includes understanding and relating to ourselves and others as sexual people, learning about physical development, sexual behaviors, and sexual health, understanding gender roles, gender identity, sexual orientation, learning interpersonal skills, and clarifying our personal values. Sexuality is experienced by pleasure, images, and emotions. It's also influenced by many factors, such as our values, family, biology, and more. What does the current research tell us about sexuality and relationship education? Autistic people and those with intellectual disabilities often experience stigma and barriers to forming intimate romantic relationships due to deficits in complex social skills, despite often having the same needs for intimacy and sexuality as their typical developing peers. Overall, it's recommended that sexuality and relationship education be tailored to an individual's needs and implemented via shared decision making of a supported team and the individual. And many authors highlight the important role of parents and caregivers in delivering sexuality and relationship education. Being proactive in these discussions can decrease the likelihood of inappropriate sexual expression, increase safety, and allow sexuality to be presented more positively. So, why should we teach about sexuality? While it can be difficult to think about your learner and sexuality, virtually all humans go through puberty and have sexual desires and feelings, with the exception of those with physical issues that might interfere with their development. There's no reason to assume that most individuals with disabilities will not be able to go on and have some type of sexual relationship. Studies on this topic found that adolescents with mild to moderate intellectual and developmental disabilities still have similar rates of sexual activity as their peers. Adolescents and young adults with intellectual and developmental disabilities are at an increased risk for sexual abuse and exploitation, and female adolescents and young adults with disabilities are at increased risk for pregnancy and sexually transmitted infections. Individuals with disabilities are more vulnerable and easily manipulated than those without disabilities. Youth with disabilities are 3 to 4 times more likely than youth without disabilities to be sexually abused, and with prevalence estimates of 13.7%. Some studies show that nearly 80% of women with disabilities have been sexually assaulted at some point in their lives, and they are often assaulted more than once. Offenders are often family members or caregivers who the person is taught to trust. So it's important that we teach sexuality so people can protect themselves. Some individuals may not be able to access written materials on sexuality. Therefore, talking about sexuality will prepare the individual with accurate information. While talking about these topics will increase awareness of sexuality and sexual behavior, it will also help to keep the individual safe by helping them understand appropriate ways to express him or herself and to learn about how others express themselves. Learning about sexuality will help the learner know the correct words to use and what behaviors are appropriate in certain contexts. It will also help the person be able to make more informed decisions and know who to talk to about his or her questions or issues when they arise. It's helpful to use clear and concise language, present small amounts of written and or pictorial information, and use multiple different types of media, for example, audio, textual, and visual, to ensure that the information is accessible to a broad spectrum of learners. People with disabilities may not know how to meet their sexual and relationship needs in ways that are aligned with societal norms. It may also be the case that these individuals are not empowered or able to make informed decisions about their own sexuality, even though they have the same feelings and intimacy needs as other individuals. Learning about sex and sexuality allows people to make informed and safe decisions. All people, regardless of disability or no disability, need prevention education so they can protect themselves, recognize that they are sexual beings, learn appropriate and inappropriate ways to express their sexuality, and learn how to develop and maintain healthy relationships. This is a lifelong process for all people. Although conversations on topics related to sexuality can be difficult at times, you, as a parent or caregiver, are a key resource to helping your learner understand sexuality and practice appropriate skills and behaviors. It's understood that families and caregivers may have different religious, cultural, and ethical beliefs about sexuality education. How you approach these topics with your learner may be based on your own values, culture, and religion, and this will frame how your learner understands sexuality and their relationship with others. Providing accurate information about sex and sexuality will help the person you are supporting to be prepared, make informed decisions, know what questions to ask, and how to stay safe. Presenting the information proactively, for example, before inappropriate self expression occurs, with an open, informative, and positive interaction will increase the likelihood the person will seek out support from you in the future. Therefore, it's important to communicate that sexuality is a natural and healthy part of life. Here are some things to consider teaching individuals about sex and sexuality. Public versus private behavior. Talk about public and private behaviors as a family and set some ground rules, such as we are only naked in the bathroom or in our own bedroom with the door closed, or we put our clothes or pajamas on before we leave the bathroom or bedroom. Remind your learner about the rules using simple words or pictures. Use the same rules for everyone in the family. Use visuals. You can also make a list of places that are public and places that are private. Then you can come up with examples of behaviors that are okay in each setting. Using visuals to help your learner understand and remember these rules can be very helpful. Stories can also help your learner understand these rules and why we have them. Think about the behaviors that are problematic for your learner, and then you could write a story that sets clear rules about when and where the behavior is okay. Puberty and the body. Explain early and often. Educate the individual on what changes to expect beforehand to help ease the stress that comes with accepting and managing these secondary sexual characteristics that will happen with their bodies. Make yourself available to talk and answer any questions the learner has while these changes are happening. The learner may have several questions about changes to their body. As you talk about the differences the learner may be experiencing or notices, try to help them relate to why these changes are happening and how it will affect their life. Changes to body, the possibility of reproduction, fluctuation in mood, and hygiene are all important topics to teach regarding puberty. Healthy relationships. Developing relationship skills takes practice and support. There are different types of friends and relationship in your learner's life. Understanding the shades of relationships can give the learner a framework for behaviors and conversations. With support and practice, adolescents and adults with disabilities can develop nurturing and fulfilling relationships. Dating. Whether or not your learner is interested in another person, you can support them by routinely talking about or pointing out different kinds of attractions or interests in relationships and appropriate ways to be in those relationships. More topics to consider when teaching individuals about sex and sexuality. Consent. Shared sexual behaviors require responsibility and understanding of the progression of the intricacies in relationships, as well as good decision making skills and communication. Consent involves understanding that the learner always asks before touching or engaging in other sexual behaviors and needs to wait to be sure the other person says she wants to be touched. The learner should also understand that they always give their consent before someone touches them. Sexual orientation and gender identity. Sexual orientation is not just about sexual intercourse. It's about attraction and relating to another person emotionally and romantically. Individuals of any sexual orientation can and do have healthy relationships and healthy sexual experiences. Gender identity refers to an inner sense of gender, whether an individual experiences himself, herself as male, female, both male and female, or neither male or female. Sexual activity. It can be helpful to list different types of shared sexual behaviors and relationships. You might start by explaining to the learner what certain behaviors might be appropriate for the type or stage of a relationship. While there are not specific right answers, certain behaviors are definitely considered more appropriate for different types and stages of relationships. Online relationships and safety. Discuss with the learner what information is appropriate and safe to share with others they interact with online. Prepare them how to deal with negative interactions that they may experience online and how to protect themselves. A few tips for talking with individuals about sex and sexuality. It's natural for people to be curious about their bodies from a young age. As children approach puberty, this topic of bodily changes becomes even more meaningful and relevant to them. People often learn from parents, peers, media, or school about navigating the changes in their body and about relationships. Observing other people is a great way to teach your learner about values and social interactions. And they may have questions about what they view in real life, on TV, in social media, online, etc. Whether you're observing others in a grocery store or walking down the street, the people around you provide great opportunities to begin conversations about values, relationships, and sexual behaviors. As a parent or caregiver, you are most likely a trusted adult that knows your learner the best, and you can provide them with honest, accurate information about sex and sexuality. Your learner will most likely have questions about their bodies, sex, and sexuality. Here are some tips on answering questions for them. Answer questions with medical accuracy. For example, if your learner asks a question about where babies come from, don't use things such as the stork brings the baby. This kind of example may be difficult for learners to understand and it's not accurate. Tip two, be honest when answering questions. So if you don't feel comfortable answering a question, just say so. You can stop, pause, find, and utilize other education resources such as visuals, books, educational videos, and return to the topic at a more appropriate time. And if you don't have an answer immediately, it's okay just to let them know that. For example, you can say, I need some time to think about how to answer that, or I'm not sure, but we can find out that information together. When having conversations about puberty, sex, and sexuality, use and teach correct terminology. It's important for learners to describe body parts and sexual acts. Use the formal words for body parts, for example, vagina, breast, and bodily functions, urinate, period, etc. This prevents confusion and gives your learner words to use when learning about puberty, cleanliness, and reproduction. Slang terms for body parts and sex acts are common, but it's important that individuals be able to use the correct terminology so they can easily be understood by others. For example, if an individual refers to their vagina as a flower or a cookie, it may not be understood by others and it may be confusing. Clarify when terms should be used in social contexts. It's not always appropriate to discuss these kind of things. Using the correct terminology versus slang is helpful if individuals need to report abuse. It's important to create a safe, supported environment for questions so individuals are more likely to come to you in the future. Stay positive and remain open. This lets the person know they can come to you with future questions or situations without being shamed or scolded. When a learner has a question, let them speak and respond back in a positive way. Try to remain open and use these natural opportunities to talk about why sexual education is important and how it can help the individual be a healthy and responsible adult. Validate the individual's questions so that they feel comfortable and safe to ask you. An example that you could say to do this would be, "That's a great question," or "I can see why you would wonder about that." Use positive language when talking about and when you have to correct them when they have inaccurate information. For example, you might say, you might think that because of what you saw in the movie, but this is what really happens." No one should be made to feel ashamed of their sexual feelings. You may be the first person who has discussed sexual health with the learner. Regardless of communication style or level of independence, the person that you're supporting can and should be provided an opportunity to learn about sexuality. All people deserve respect. You may not agree with or share the same values as the person you're supporting, but you can respect their decisions or actions based on their attitudes and values. Speak to or direct them in a way that's respectful. It's also important to have these conversations privately so the person is not embarrassed. This also models that conversations related to sexuality should take place in private with people the person trusts. Visual supports can also be developed for teaching purposes. Ensure the visuals use language appropriate to the learner's communication learning style. It may be helpful to avoid abstract, ambiguous, or cartoonish illustrations that may be hard for the learner to understand. Finding those teachable moments. As a parent or caregiver, you are a consistent presence in your learner's life. Therefore, you can find many opportunities to infuse lessons about sexuality into everyday life. Take the opportunity to use television shows, news stories, or interactions you witness as a way to highlight a particular topic. From these real life examples, you can help the learner understand how to respond to a situation and explain why it's important. Here are some strategies to think about when teaching your learner. Modification to materials or information may be needed so the person that you're supporting is able to learn the material in a meaningful way. You can present information into smaller chunks. Use clear, simple language and avoid or define jargon. Repeat and reinforce key concepts often. You need to go over the information multiple times. Highlight key concepts and provide frequent reinforcement so your learner is motivated and engaged with the materials. You know the ways your learner learns best. Teach about puberty or sexuality the same way you teach about other important topics. Consider a variety of teaching strategies when working with your learner. Some people learn best when information is presented in different ways. There's no one size fits all approach to teaching and learning. Think about the way the individual you're working with learns most efficiently. What strategies have worked well for them learning something in the past? You might want to utilize a variety of different learning methods to see what works best for the learner if you're not sure how they learn best. People often learn when you use visuals or in real world situations. You can include pictures, videos, role plays, and social narratives to help. If an individual learns best with pictures, try using visual supports or social stories with pictures. Social stories can also help your learner understand information or rules regarding behaviors and why we have them. Think about a behavior that's problematic for your learner and write a story that sets clear rules about when and where that behavior is okay. Social scripts can also be helpful because they teach the learner what to say in certain situations. It might make sense to combine social scripts with role playing to improve social and communication skills. Remember, gradually fade and remove scripts as the learner gains the skills. Role playing or interactive games are another way to engage learners and practice materials. For example, you could work on role playing asking someone on a date in an appropriate way. Behavioral skills training is an evidence based intervention for teaching new skills. I'll briefly go through the steps. Step one, explain the skill. Provide an explanation of why a particular skill is important and discuss the step by step instructions on how to do the skill. Step two, show the skill. You're going to be modeling what the skill looks like so the learner can see it when it's used correctly. Step three, practice the skill. The learner practices the skill in a role play situation with you. Step four, give feedback. The learner is given positive feedback, and you do this by letting them know what they did well and offer corrective statements on what they still need to work on. It's important to note that you can't assume that because a learner performs a skill accurately during rehearsal or in a role play situation, that they will be able to use that skill accurately and fluently in a real life situation. They may need additional training and practice in the real life situation to perform the skill. A few tips to think about when using behavioral skills training. The adult responsible for the intervention should consider the following. Remember to break down and clearly define the steps you want the learner to demonstrate. Adapt your level of language and the complexity of the model to the learner's ability to comprehend. Provide a model of what typical learners his or her age might say and do. Allow the learner to practice the skill in a safe environment. Practice newly learned skills several times and end on a positive note. Provide ample and descriptive praise for correct demonstration of the skill. Masturbation is a topic that frequently comes up when parents and caregivers are teaching their learner about sexuality. Exploring one's private body parts is a normal part of development. It's important to teach when and where sexual behaviors are allowed. Almost all people at some point will discover their private parts. Every family has their own values and beliefs about this behavior, and it's okay to teach your child what your family believes. It's a normal part of development for boys and girls to touch themselves at times, and it almost is impossible to stop this behavior completely. So, teaching the individual when and where this behavior is allowed may be the best option. Punishing, shaming, or giving the learner a lot of negative attention may actually make it happen more. It can create negative attitudes around a natural behavior and may decrease the likelihood the person will seek accurate information related to sexual behaviors in the future. Antecedent strategies can prevent issues with masturbation. Antecedent means before the behavior occurs. Antecedent strategies are things you can do beforehand to prevent or reduce problems associated with masturbation. While you do not need to feel completely comfortable talking about masturbation, it's helpful to talk calmly, clearly, and convey acceptance to your learner during your explanation and discussions. Masturbation is a normal, healthy behavior, and conveying that in a calm, clear voice can help teach that there's nothing to feel ashamed or bad about. Setting specific guidelines as they pertain to masturbation can really help. However, you want to make sure that you are being really clear. Guidelines can be set as to where and when it is appropriate to touch genitals. You might say, you can have private alone time every day. Then you need to teach the concept of private time to your learner so they can understand that it is an appropriate time to masturbate. Masturbation must take place in a private space like your bedroom at home, and it should never happen anywhere in public, including public bathrooms. It's also okay to teach the learner that sometimes masturbation is just not an option. Sexual release is a basic human need, and we don't want to deny or punish that need, but it might be helpful to build a schedule to show your learner when she has private alone time that could be used for masturbation. Social narratives can be adapted to include information about when and where the person can engage in that behavior. You might need to redirect the person to an appropriate behavior when engaging in inappropriate sexual behaviors. Example, you could have them try labeling items in the store, maybe finding items of certain colors, or pushing the cart. Placing visuals on the door of a bedroom also provides a cue that this is a safe, private space that they can masturbate in. Teach the learner what to do after they masturbate. This may include changing sheets, putting underwear in a laundry basket, and washing their private parts with a wipe or a wet cloth. Consequence strategies are used after the behavior has occurred. If your learner starts to masturbate in a public area of the house, physically guide them to their bedroom and say, only masturbate in your room. Use a calm voice and keep it simple. You can provide reinforcement for when the individual does masturbate in his or her bedroom and nowhere else. But if masturbation behavior happens in public, you need to interrupt the behavior. Remind your learner of an appropriate time and place to masturbate. Redirect your learner to another activity, especially an activity which they might need to use both hands or physically move something, or try an activity that requires focus or movement, or redirect him or her to a private area if that's available. Remember to try not to overreact. Remember to stay calm and keep your voice steady. Direct your learner to a private area when they do things such as touching private parts. And you can do this by telling the learner where to go perform the private behaviors using simple words or pictures. For example, saying something like, you can do that in your bedroom, and show them a visual. Redirect the person to an appropriate behavior when engaging in inappropriate sexual behaviors. This can look like having them label things they see, finding things of certain colors, or doing things with their hands that make it impossible for them to masturbate. It's helpful to think about the function or the purpose of the behavior rather than just focusing on the behavior itself. Identifying the function of the behavior can help with developing targeted interventions. Just because an individual is touching their genitals doesn't mean the function of the behavior is strictly for a sexual purpose. For example, some people might touch themselves because it is a calming sensory experience. Others might touch their private parts because they itch or hurt, which could be a sign of an infection. So, thinking about these things, possible interventions could be teaching the learner other calming sensory experiences that satisfy the same need, getting them medical care if it's related to something that's going on with their body, developing activities to reduce boredom if they're masturbating out of boredom, or scheduling private time to reduce the frequency if it's happening too often. Here's the reference list used for this presentation. References, more references. Thank you for watching this presentation.